Okay. This is Paul Lynch. This is day 4 of my experience in the ICU in New York City during COVID-19 pandemic. I wanted to start off by taking my mask off the correct way. I got multiple messages telling me to be careful, and I don't know what I was thinking on the video yesterday. I just grabbed it with one hand because I was holding my phone with the other. This probably demonstrates why 50% of our residents here in the anesthesia department are estimated to have COVID at this point, because you just make mistakes during the day. But I wanted to do it the right way so that I can be an example. You should never touch the front of your mask. Today's Easter. Happy Easter to everyone. That was both hard and wonderful. My daughter sent me a message, which I'm going to show you.
Happy Easter, Daddy.
You miss him?
Yes.
You love him?
Yes.
Say bye-bye.
Bye-bye. Happy Easter, Dad.
So it's hard being away on Easter, but it was also nice to see a wonderful message from my children. Speaking of my children, people sent me messages about my mask, and they were exactly right. But probably 10 or 15 different people, including a lot of my friends, have reached out to me to tell me, with 5 kids at home, it's crazy for me to come to New York. But I actually disagree with that point. I would tell anyone that I'm trying to raise children that are going to change the world. I want kids that'll run into a fire to save lives. That will make a difference. And I think the only way to do that is to live by example. So I expect fully to do well while I'm here and to be healthy. But I think it's the right thing to do for my kids. Today was easier than yesterday emotionally. Yesterday I was on the airway team, and so people that were gasping to breathe and in a very scary situation. I saw 9 or 10 different patients yesterday, but today I was on the line team. What the line team means is, as an anesthesiologist, we're adept at putting in central lines to give fluids and also to measure pressures on the right side of the heart. And we also put in arterial lines, sometimes in the arms, sometimes in the legs, sometimes more advanced lines like Swan-Ganz catheters, which I won't get into on this video. But today I spent my time putting lines in the ICU, which I think gave me a little bit of an emotional break, because the patients were already asleep and stable, and we would just go and put in these lines. And I think we did a lot of good work. New York is right in the midst of kind of the peak. The peak some people talked about several days ago, but really we're right in the midst of the peak now, because even though the actual peak for cases was about 7 days ago, now the peak for ICU admissions is happening now, and so I'm glad that I'm here at the time that I am. Just in the time I've been here in 4 days, we've lost over 3,000 people that have died in New York. That's more than 9/11. Yesterday, it was almost 800 people that died, and it's become such a crazy thing that the governor's actually called in funeral directors from around the country to help just to bury the people. They're paying prisoners from Rikers Island like $6 an hour to bury graves, and this is unlike anything I've ever seen before. But you can talk about numbers. You can say 3,000. You can say 800 people died yesterday, and I think people miss that. I see people talk about coronavirus versus the flu and how many deaths it is, and it's not that many deaths. And I have to tell you, as a physician, every one of these people matter. Every death, every number that you see on TV, there's a person behind that. Because of rules on HIPAA, I can't talk about the people too much, but I had a patient yesterday that was an immigrant from another country, and I talked to him as his breathing was desaturating, and it was clear he couldn't breathe on his own anymore. And he came here to America, and he made something of himself, and he started working in surgery, and had a wonderful job and a wonderful life. And I just think about the impact if he's not here anymore on his family. Amazingly, I got to see him again today. Yesterday, we put a tube in today I went back to see him, and he was in a room with 2 people in a room, which is what we're doing now. We'll have an ICU room, and not just 1 patient, but 2 patients. It's because we just don't have room in the hospital for all the patients that are intubated and are getting intensive care. So I went back to put an arterial line in the other patient in the room, and I saw him, and I told him that I was still praying for him. People might think it's crazy to talk to someone on a vent because they're sedated and they're asleep, but I think it helps. And so I said hello, and I told him I was praying for him, and it was good to see him, and I think he's going to survive. I want to give you at least 1 teaching point today. Yesterday I tried to do 2 points, but there's not enough time. So today I just want to say that my teaching point is logistics. If this comes to your community, you have to be prepared. Logistics are so important. You'll see stories on TV about healthcare workers running out of PPE. And at least in New York right now, we're not really running out. Sometimes we just can't get it to the right place at the right time because we're not prepared for the increase in volume. Let me give you an example. When I used to work in Bellevue, we might intubate a patient on a floor once a week. It wasn't common, so we had 1 cart to go to a code if we needed to intubate patients. But the docs here prepared, and now they have 5 carts, and they're ready at all times, and they're ready not just to intubate 1 in a week, but 10 in a day. And that means 10 times as much supplies or more, 50 times as much supplies. For everything that we normally have, we have to have way more. And so I would just say logistics are important. If this comes to your community, you have to have more resources. And that's one of the reasons we put lockdown on everything except essential and emergent procedures, is to divert all these resources to where they're needed during this time. So that's my video for today, day 4. Stay safe, and I'll see you tomorrow.